Good evening, and thank you for tuning in to another week with Fathers Who Care. We were just in a state of prayer, and we was in a state of stillness, of peace, of tranquility. And we want to invite you, the viewing audience, to find your center. Find your center, find your peace. The world is so full of so much going on today, you don't know which way to turn. But we know that the God that we serve is still able. No, I'm not here to just talk about God today, but God is our center, God is our anchor, God is our focus. But according to what Dr. Jasmine has been sharing for so long, and I'm going to share it with you if she don't mind. She keep on saying over and over and over again, my people perish for the lack of knowledge. So we're bringing Dr. Jasmine back. We couldn't wait to get Dr. Jasmine back to some of you all who are viewing us this evening. But I need to be honest. I get a dose of Dr. Jasmine once or twice a month. I'm saying Dr. Sorrell, forgive me. Dr. Tanya Sorrell, forgive me. I mistaken. It was a Dr. Jasmine who used to be with us. But Dr. Sorrell, forgive me. Y'all know who I'm talking about. So charge it to my head and not my heart. I'm on fire, but I'm on fire about what we got going on with Dr. Sorrell. Dr. Sorrell, as you know, is number 2. This is her number 2 time of being with us. I couldn't wait to get her back. And I also compare her off and on to the relationship that we've had with individuals out of Cook County, out of Stroll, just different places. But Dr. Sorrell is representing Rush. And I kind of made a reference to her in the relationship to Dr. Jasmine because prior to Dr. Sorrell coming, Dr. Jasmine was with us. And Dr. Jasmine used to be our anchor when it talked about things in the neighborhood, when it talked about health, when it talked about a lot of the plight of folks, what folks are going through. And it, like we did not miss a beat. Of course, things have a season. Dr. Jasmine left. And before we can even get planted, Dr. Sorrell came in, and I'm talking about came in at community meetings, came in community in the evening, in the morning, all over the place. And then if you ever had a chance to talk with her or hear her present every month like we do, you would know that her heart is in the right place. So to make a long story short, we came, at the last time you were here with us, we said, well, listen, Dr. Sorrell, would you do us a favor? Because we had so much going on in that last one. Can we do a part 2? And she agreed. And so here we are again talking to Dr. Sorrell, and we're going to talk to her off the cuff. We're going to talk to her about the plight of what's going on around our city. Of course, I'm going to try to do my due diligence to try to introduce her to some degree, but for those who know her, you know that she's, of course, Dr. Sorrell, Tanya Sorrell. She's an associate professor of the Department of Psychiatry and Behavioral Sciences, the director of Rush Substance Use Disorder, the Center of Excellence, Assistant Director to the Great Lakes Region, NIH, and NIDA, Clinical Trials Network, co-chair of the Illinois Harm Reduction and Recovery Coalition, and she's a member of Rush University College of Medicine. I mean, there's so much going on. I'm going to just put it frank to most of you who are watching. She's a servant.
Well, thank you, Rev. And, I think that's the most important part is that we all want to make sure that we can help. We know that people are out there and suffering, and we know that help is available and help is here, but sometimes it's hard to reach out or even to feel like, if I do reach out, will someone care? So we at Rush really want to let the community know that we're part of the community, we're here with the community, and we really want to make a difference in the community.
Well, now you see it. You felt that passion. It was subtle, but it was true. So we're going to run with that passion. So I'm introducing to some, presenting to others, none other than our dear sister and our dear friend, and a real servant for social change and community empowerment, none other than Dr. Sorrell. Dr. Sorrell, thank you so very much. I guess I was a little heated earlier but I'm back.
Okay.
I'm back on point, and I'm here. But Dr. Sorrell, if you would do me the honor, I do know how clinical you are and that you do what you do on that professional level, and thank God for that, by the way. But I like to, if I can, I would like to come at you and ask you, I'm going to flip the script just a tad.
Okay.
Who is Tanya?
You know?
Is that okay?
That is okay.
Okay.
Truly, Tanya and myself is someone who cares and really wants to make a difference. All my life growing up, I've been the person that people came to talk about what their issues were, their concerns. Even before I knew what a counselor was, people, oh, I have this problem. I'm having my boyfriend of this. And I was the person listening. So I think because of that listening and really wanting to hear what people were going through, that was something that's always been a part of me, that's want to be able to listen, hear where others are, and to be able to make a difference in each other's life that I'm able to reach out to and try to help.
So as you know, you're watching Fathers Who Care, and we've been doing this show for we're going into, next week would be our 13th week, and we thank you all for tuning in with us, but we've been on this show for some years, and this is a platform, and we thank CAN TV for allowing us to bring our various guests to you, those who may not get out to the community events that we are hosting and presenting out in the community, but you get a chance to tune in every Thursday to the show, and we also empowering our young people. But again, thank you for tuning in and for supporting Fathers Who Care. And if you all don't mind, just hang in there a little while longer. And we're going to come back and we're going to talk to Dr. Sorrell. And as you notice, she's really a humble spirit. And her spirit is always, since I've known you, the spirit has always been about empowering. It has always been about bringing folks together. So let's go down that road. Okay. So but I want to talk to you specifically about some things that are pressing in our community. And then I want to come back and ask you about the mission behind the work that you're doing with Rush.
Okay.
Or you can take it Rush first and then you can come back here, because I think there's really important that we understand the plight of what's going on in our community. So what is the state of suicide in our community? And why is folks so apprehensive to talk about it? It's like it's like folks are apprehensive to talk about mental health or going through changes or not being okay, which you don't subscribe to. You always encourage us that, in essence, that you have to speak certain things into existence, but also a closed mouth don't get fed, in essence. But go ahead, please.
You know, that's a very important question, and it's such an important question for our communities. You know, traditionally, cultures, black and brown cultures, we kept things to ourselves because we may have had to just get over to get to the next day. But we know that those little things, each time we had to swallow or felt that pain in our stomach, it takes a little bit of us. And it can do that to the point where we feel hopeless, helpless. But there's never been a good venue to be able to talk about, to share that hopelessness, to be able to say, to reach out, particularly for men who are told, you know, buck up, keep it to yourself, you know, and where does that negative energy go if we don't speak, if we don't reach out? It has sadly led to suicide. And we do know that unfortunately, suicide rates, particularly in the black community here in Chicago, are higher now than at any point in the last 20 years.
So talk to us more about that. Give us some of the data you or give me some of the reference to make it, because we heard about suicide and we heard about more young women committing suicide than young men. But go ahead and give us some more of that information.
I certainly will. And it is a trigger warning because it is a sensitive subject to talk about.
Please.
But I think the importance
is...
But it's
education.
And we need to talk about it. The more we talk about that, hey, when we're feeling down, when we're feeling hopeless, people may feel like, what's the point? Like life isn't worth living. Because we don't recognize and talk with people about saying, hey, people feel like that way from time to time. When people have these thoughts, they wonder, what's wrong with me?
Right.
And it actually makes them feel worse when they have thoughts that life isn't worth living, because then they also start to judge themselves and punish themselves for having those thoughts. But we know that that occurs as part of depression and when people start to feel hopeless and helpless. Sadly, what we've seen is that black suicide deaths have increased from 12% in the population in 2019 to now over 23% in 2022. And particularly for males, 3 in 4 suicides that have happened in Chicago for 2022 were black men. More likely because guns are available, and so men are more likely to shoot themselves or to do a more fatal, a more violent means of ending their lives. Women may sometimes more likely take an overdose of their medication or overdose of pills where they may be found and then brought to a hospital for treatment. Men are more likely to end their lives by violence or shooting themselves, and so it's harder to save them if they do attempt to end their lives.
So what can we do as service providers, as community leaders or stakeholders? What can we do to address this plight?
Across all of those groups, stakeholders, providers, and even family members, the first thing that we know is that we have to be able to talk about it. There used to be an urban legend that, oh, if we ask about someone, are they having thoughts of suicide, that it's going to make them go and do it. That has never been shown to be the case. If you ask someone, they will tell you honestly, listen, and believe them. And explain to them, hey, you're important to me. I need you here. How can I help? Right now, for the issue that you're having right now, when someone's depressed, it makes them think that the only thing that's happening is right now. Help them to see, let's get over this one issue and then your life and your expanse can broaden. Let's get over today. Let me help you and share that load today, and then let's go forward to be able to help you in feeling better.
So I'm going to roll that over into some of the work that you're currently doing, services. We know that you're committed. That's so obvious. But what programs and or services are available at Rush to address poor mental health, substance abuse for people of color?
There are several programs that are available.
Okay.
Starting even from young children, because we know what we call adverse childhood events, issues like divorce, abuse, neglect in the environment when it's not safe, or being around where there may be violence. Those adverse childhood events lead to increasing the likelihood that someone may become depressed, that someone may have even physical problems, and that someone may be at risk of substance use. We have a program at Rush called Building Early Connections, where we help young kids 4 to 8 years old to find those social connections, to help parents learn how to engage with children better, to listen, to be able to hear what's going on, to ask, what happened at school today? How was school today? How did you feel during the day? To help build self-esteem, to address any issues of trauma that may have happened, because those adverse childhood issues cause trauma. Trauma then leads to pain. Pain may then develop into depression. It may develop into acting out and violence, and it may develop into substance use.
What is the significance behind this term I keep hearing folks say, which I kind of agree? Hurt people hurt people.
Exactly. That's exactly it. That pain that I was mentioning is that hurt. And if they don't have a way to express it, to relieve it, then it acts out. Because they have to get that pain out some way.
So when it comes to young people, you know, I'm a strong or firm believer, I should say, that young people with a limited capacity to really articulate exactly what they may be feeling from time to time, they try to show themselves or express themselves in other ways.
Right.
So they may go into substance use, they may go into violence, they may do some dysfunctional things out there and involve themselves in some negative activities, right? But they're trying to reach out. I want to come back to the parents, because I think a lot of what we're suffering with some of our young people may stem from our homes. So what can parents do to engage and empower their children? And what can we do to engage more parents in engaging their children or to empower their children?
Two very good questions.
Okay.
The first thing is for the parents to listen. Be there, be present. Put our phones down right now, have just the child and say, hey, what's going on? I want to be here for you. And then listen, and recognizing that as the parent, you are the one that's setting the role model for what your child is needing, for the boundaries that they need to learn to follow in society, and for the love, nurturing, and support that they can help them get over the pain, the trauma, or the hurt that we were talking about. You have power as a parent that frequently parents may not realize. They feel that social media or TV or the friends may be the most important thing for their child, but you as a parent are the most important thing. So we as providers can help empower parents to parent in just that way.
And so what we're saying, parents, is we're saying that we know sometimes you might need some external assistance. We want to provide that. We don't think no one is incapable of being everything to everybody. We think all of us need all of us. I mean, the more the merrier. If we can all just pool our intellectual resources and come together and build each other and empower each other like we used to do in our history of values that we came up on, the norms and values we came up on was about that.
It took a village.
Yeah, it literally.
It took a village.
And we literally was a village. So what I'm hoping that we can do as we continue to do the work that we do, all of us have an intricate part in building the village. So we should not hold back our resources, hold back our intellectual properties, but instead come together. Let's stop being individuals about things. And no, it's about me. It's not about you, because it could be no you without the community. So we need to work together. But I want to come back and I want to talk specifically about some of the things that we're facing in our communities.
Okay.
But something keep on drawing my attention. And what keeps drawing my attention is the fact that we are facing so many ills in our community. And the quality of life for some folks are dissipating to a level unthinkable. And then with the onslaught of the legalization of cannabis and all this other stuff that's going on, people are just trying to escape. So what can we do to build up the hope in people in doing this? I mean, I'm just being frank with you.
Sure.
It is depressing watching the news.
Right.
It is depressing to see how the state of things going on politically is going on. And if you're not tuned in, folks would just, throw up their hands and run to the hills, right? So what can we do to improve the quality of life for folks, but also to build up hope?
Right.
Yeah.
And it is very important to recognize, too, that even from our media and what we see from social media, they get notices, ads, money from the clicks.
Okay.
So the positive things don't always draw clicks.
Okay.
But the negative things, the violence, those issues, something that'll make you, I want to read about that draws clicks. So you know that gets highlighted.
Okay.
But what you can do is realize what's happening in your home, and as you said earlier, in your community, in your village. Focus on what you can make a difference in.
Okay.
What's that serenity prayer? Grant me the difference and the knowledge to know the changes that I can make where I can make them.
Absolutely.
I can make a change in my home, in communicating with my family, in working together and helping to instill self-esteem, goals, boundaries, and a purpose. When kids have a purpose and a meaning, they know what their life means for them, and that it's not just, as you said, all about me. That it's about me, my family, and my community. And then get to know your neighbors. We used to know our neighbors. If the lights came on at 6 o'clock, a neighbor would tell you, okay, head on in because your mom's going to be walking out the driveway. Know your neighbors.
Yeah, that was the values. Then.
Exactly. You could get home and several people will have called for something you did 3 blocks away.
And or disciplining you down
right
the blocks.
There. And the parent would say, thank you for letting them know. Because the community helped to enforce, empower, and encourage each other.
Well, Dr. Sorrell, so many folks are just throwing up their hands when it comes to empowering our young people. And right now, I have to say that our young people are literally crying out. I believe it. I see it. I feel it. They're crying out. So what can we do to educate more young people to refrain from substance abuse, to refrain from joining gangs, to refrain from being victims or perpetrators of senseless violence?
We have to talk to our kids
and
listen to our kids.
You said that.
We used to think, okay, if I don't say anything about drugs, then they're not going to know about them, they won't use them. We
Okay.
can't do that.
Okay.
We can't just say no. In this day and age, it's a TikTok challenge. Let me try this. Oh, I heard this was super strong. So I want to go and try it because I'm
Absolutely.
invincible.
Yeah, jumping out of cars and cars rolling and all this foolishness.
Exactly. Or dancing along while the car is moving.
Yeah. Or trying certain substances, right? Okay.
Exactly. Those are
Okay.
the same things because kids need and want attention.
Okay.
And if they don't get positive attention, they'll look for negative ways to get attention.
Okay.
So we
Go
give
ahead.
them the good things that can help them get positive attention. Educate them about drugs and substances that are out there. Because the things that we may have dabbled with when we were in high school or our parents were in high school, those things won't kill you. But fentanyl is out there and it can kill you and take you out. So you need to educate kids about, hey, even if you might use something at a club or take a pill because you have a test coming up, it could have fentanyl in it and it could cause an overdose. So let's talk through what we need to do to prepare for the test. Let's talk and role play and practice what you're going to do if you're going to go out with friends and someone offers you a substance. Talk through what you'll need to do and shore up that self-esteem to be able to say, no, I had that conversation with my mom. I already know what to say when this happens.
Okay. Okay. So let's talk about something that's spiking. We've talked about COVID. We talked about the numbers with COVID. COVID is really not going away, correct?
No, it's going to have an ebb and flow where during the wintertime it goes up. As right now, as we're heading into spring, it's starting to get less and less. But there may be increases at any point at this time.
So, but COVID is still
it's
alive?
still there.
And well?
It's still alive and well.
And so what can folks do to combat?
The main thing to do is, one, if there's a boost, when the next booster is available, get the booster vaccine. Because the COVID virus is actually what we call evolving. So the initial COVID that was happening in 2020, that's not the virus that was out and causing problems this winter. It looks different now. And so if you first got the
Is that the
vaccine,
JN1?
that's exactly, you remember.
Okay.
You remember, that's the JN1. That was the problematic strain of the COVID-19 virus this past winter. And it caused not only those same respiratory problems, but also GI upset and problems. So people may have thought they had a stomach flu, and then a couple of days later, they could barely breathe if they hadn't had an updated booster.
So, Dr. Sorrell, what about this measles outbreak?
That's another concern that sadly was totally preventable, but with vaccines can be, again, totally preventable. In the 2000s, all kids, or the majority of kids, would get their vaccinations over 95%. That's what we call...
They had to have it to go to school, right?
You had to have it to go to school.
Right.
And that's what we call herd immunity. When 95% of kids have their vaccines, then the few that can't because they've had childhood cancer, or they may have a religion that prevents them from taking blood or shots, then the 95% herds and keeps safe those few that don't. Unfortunately, in the late 2005, 2006, there became an urban legend that, okay, vaccines may cause autism. It was proven and totally untrue, but people started believing it, unfortunately, and they stopped getting their regular vaccines for kids because they were scared. And unfortunately, from 2000 to 2019, there were no cases of measles in the entire United States. But since then, we've had outbreaks. And right now, we have an outbreak in 17 states, including here in Chicago.
Well, you heard it here, and we want to thank you for tuning in to Fathers Who Care. Remember, we have after-school programs, internship programs, violence prevention programs, parental involvement programs. We have youth engagement programs. Our young people are always doing something together. Next week would be spring break, I believe it would, for the young people. The young people at Fathers Who Care will be visiting DuSable Museum. They'll be going on some other field trip baseball games. So we're going to engage our young folks with some recreational activities. We're going to keep them involved, and we want to encourage those who are watching. Parents, if you are watching us tonight, we want you to know that we care about you. And we know that you can't do it by yourself. And we know every now and then you want those young folks of yours to be able to go into a nurturing and warm environment where they can be safe. I'm informing you today that Fathers Who Care is a place for young people. We are a young organization that's committed to the young people. We love our young people. We want to empower and engage our young people. And as you're listening to, of course, Dr. Sorrell here, obviously she has a passion for young people too. She's definitely keeping us in the loop on what's new, what's going on. But most important, she wants us to also know that it is always time to listen to our young people, to engage our young people, but most of all, to empower our young people. So if you need additional information about Fathers Who Care, you can log on to fatherswhocare.org or give us a call at 773-287-5821, 773-287-5821. Again, call Fathers Who Care. If you need any kind of support, we're recruiting young people always for our after-school programs, our youth council, and for empowering these young people. I'm going to come back to Dr. Sorrell, and I'm just going to put out just a blanket.
Okay.
What would you like for the folks to know, and how can they get in touch with you or follow some of the work that you're doing?
Thank you so much for that.
My pleasure.
We at Rush's Substance Use Disorder Center of Excellence want to make sure that everyone knows and understands that substance use doesn't need to lead to an overdose or death. We provide free education to the community, any community group or organization, about substance use issues, topics, ways to prevent overdose, how to understand that Narcan, a medication that actually will reverse an overdose, can save a life. And who doesn't want to be a lifesaver and be a Superman?
I'm not going to let you get past that Blue Monday, too. So behind that, go ahead and bring that in, too.
No worries. We want to make sure that everyone knows that there are resources available. So many communities, sadly, don't know that there are people that look like you, that care for you, that want to reach out and provide education, resources, and access to mental health and substance use services that really can make a difference in your lives. You can reach out to us by email at rush, SUDLC, @rush.edu. Rush, RUSH, SUDLC, @rush.edu. And we will come to you to provide the education, support, and assistance and services that you need to help make your next day better than your last day and keep things going in the right direction.
Well, we believe that if it is to be, it must begin with me. So that means that if we really want to change what's going on in our community, if we really want to empower, folks come in with different levels, and we understand that. But one thing we can't afford just ignorance of the matter. When you know better, you do better. All right. So let's continue to educate. Let's continue to empower each other. Let's continue to listen to our children. But most importantly, I am not my son or my daughter's friend. I am their parent. All right. It's a difference. All right. And we need to be more disciplined about our children, because 9 times out of 10, the things that's going on in our neighborhood is from one of our parents' children. All right. And we're not saying you're not good parents. We're just saying we need to work together to support each other in whatever we're going through. So, Dr. Sorrell, give us some closing comments.
Just as you said, we all need to work together, and we need to feel okay to reach out when we need help. Sometimes we'll feel like, oh, I don't understand this, or I don't know what to do. That's the time to say, hey, there are people that want to help and can make a difference. We worry about what may happen, but when we don't reach out, we sadly know sometimes things may not go what we want in ways that things happen. Reaching out to get help is the best way to say, hey, you're there for me, I'm there for you. We all can work to make a difference and help friends, families, parents, and kids to make a better day for the tomorrow.
Well, you heard it here first. So keep in touch with Fathers Who Care. We look forward to seeing you next week. But in the meantime, God loves you. We love you. Continue to do the good work. Continue to listen. Continue to be empowering, to engage our young people. But most of all, continue to provide a safe haven for all family members. Well, look, it's been a fun time. We've been having fun as always. We hope that you got something out this show. We'll see you next week. God bless. God keep you. Look, continue to look to the hills for your strength. But most of all, God bless you and good night.
We're here to help.